In order to do this, you should remove your glasses and have the patient remove his or her glasses as well. If the person is wearing contact lenses, or if you're wearing contact lenses, they may certainly be left on. The light should be placed on, as I'm demonstrating here, and the patient is asked to look in the distance. You should stand approximately 15 to 20 degrees off midline and elevate the patient's upper lid as the ophthalmoscope is placed against your right eye to examine the patient's right eye. The first thing that you'll notice is the red reflex. If a red reflex is not seen, one has to be concerned that there may be some opacity, such as a cataract, in the lens. As you move closer to the patient, you will turn the lenses to focus deeper as one gets into the eye, past the lens, through the vitreous, and then into the retina. You must always be at eye level with the patient. First visualize superior nasal, inferior temporal, and superior temporal. And Mr. Johnson, please look at the light. And at that last second, the patient's macula has looked directly at the light, and one is looking then at the fovea of the macula. We repeat the same procedure on the left eye using your left eye and holding the equipment in your left hand. And again, I'm about 15 to 20 degrees off of midline, and keep looking in the distance. And as one gets closer to the patient, the diopter wheel focuses first as we go through the cornea, the lens, the vitreous, and now the retina. The optic disc is well visualized, as is the vasculature. Looking superior nasal, inferior temporal, superior temporal. And Mr. Johnson, look at the light, please.